While we envision low triglyceride levels as a sign of a good metabolic system, it may not always be the case. Please allow me to explain. My name is Dr. Enin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, I'm going to be talking about triglycerides, which is a type of fat found in the blood. And the predominant drivers of triglycerides are chronic consumption of carbohydrates and alcohol. Now, the goal of any metabolic health specialist is to see their patient with a low triglyceride levels. But there are cases, which is the case I have right in front of me, where low triglyceride levels may be indicative of a health problem. Now, before I speak specifically about these labs I have in front of me, I want to speak generally what are some of the things that will drive low triglyceride levels. It can be in two folds. It can be a case where high triglycerides are being masked, and in some cases, it is just low triglyceride levels because we don't have the substrate, because there's malabsorption issue. We don't have the substrate to make triglycerides. There are certain situations where triglycerides will be low, and one of them is malnutrition and the malabsorption. So people with gut issues, like the celiac disease, like the Crohn's disease, like pancreatitis, SIBO, which is the small intestinal bacterial overgrowth, pancreatic insufficiency. These are all conditions that can affect the absorption of dietary fat and fat-soluble vitamins like the A, D, E, and K. So when you have conditions such as gut infections, there's something we call the protein-losing enteropathy, where it causes low albumin and lipoproteins in the blood. These are all situations that can affect our triglyceride levels. So triglyceride may be low, but it may be indicative in the bigger picture, in the general scheme of things, of a health issue. The other thing that can lower triglycerides is hyperthyroidism. People with thyroid issues. So in these people, they have an overactive thyroid and it can speed up metabolism. And some of the signs that we will generally see with these people are weight loss, rapid heartbeat, heat intolerance, and sometimes anxiety. So the other thing that can affect or cause triglycerides to be low is liver dysfunction. And this will happen in cases of liver diseases such as cirrhosis or hepatitis. And this can lead to abnormally low levels. So in clinically, I have seen people with hepatitis B, with cirrhosis, where it looks like they are metabolically healthy because their triglycerides are low, but it's indicative of a bigger problem. And considering their diet and nutrition, it can really get you a bit confused if you don't understand these numbers. So hepatitis B, people with cirrhosis may have consistently low levels of triglycerides, which may not be indicative of a good healthy system. The other thing that can also affect or lower triglycerides is chronic illness, like people with the autoimmune diseases, people with cancer. They can have abnormally low triglyceride levels, which is indicative of a problem, which is a red flag and not a victory. And the other area too that we want to look at is certain medications and supplements can also lower triglyceride levels. And this will be high doses of omega-3 or the fish oils. And there are certain prescription drugs called the fibrates that can also do that. We have supplements called niacin that can do that, and you have prescription ones that can also do that. So these are all things that can lower triglyceride levels, but it's not really indicative of a good metabolic system. And of course, there are genetic disorders that can affect fat transportation. And of course, mitochondrial issues are all things that come into play in terms of our triglyceride levels. But in this case, I want to focus on the labs I have in front of me. So this person have a history of gastritis, okay? Their diet is predominantly grains, specifically white rice. Okay, they are borderline diabetic, they are pre-diabetic, so to speak. So as a metabolic health specialist, as a functional medicine doctor, I am trying to get to the root of her situation. One, she has a history of gastritis and small intestinal bacterial overgrowth. She's always bloated. So I am trying to figure out why she has low triglycerides, yet she's eating a lot of grains. Her A1C is in the pre-diabetic state or pre-diabetic range. So these are all things that beyond the pharmacy we do in the functional medicine clinic, because we are trying to figure out why she has such a low triglyceride, yet she's pre-diabetic. So when we get this kind of labs, and that's what I do, I focus on getting to the root, trying to decipher what is really driving her metabolic issue. She has a lot of issues going on. But if you are not in the know, if you're not in the business of trying to find the root cause of issues, you wouldn't get the bigger picture. So this person have low triglycerides, they are insulin resistant, they are pre-diabetic, they have chronic issues with the gut. So I am trying to figure out, as a clinician, as a metabolic health specialist, as a functional medicine doctor, what is really driving her condition. So I realized that she is not absorbing a lot of the things she's eating, and that is affecting her metabolic health. So low triglycerides may not always be telling us a full story. We need to look at the bigger and the clinical picture. We need to look at it from a holistic standpoint, which in this case is what I am doing with this person. We have to understand these things from a holistic perspective. So low triglycerides, even though that's what we want, consistently low numbers, less than 50 milligrams per deciliter, we need to look at what is happening. We need to look at their diet and nutrition. We need to look at their health conditions. We need to look at other parameters. This person has a family history of stroke and hypertension. So we need to be in the mindset of understanding clinically or getting a full clinical picture of what is going on. So that is why when we give our questionnaires out, it's very detailed. It's asking for your medications that you are taking, and it's also asking for the supplements you are on, because all this will come into play with respect to what your labs are saying. I always say this, your labs are always telling us a story. It's giving us some clues. Everything is black and white in the labs. It is often not interpreted well. So low triglycerides, consistently low numbers of triglycerides may be a health problem, and we need to look at other things. In this space, I'm more focused on the metabolic aspect. So low triglycerides may not always be a healthy thing. We need to look at their A1C. We need to look at their fasting glucose. We need to look at their HOMA-IR. We need to look at their fasting insulin. These are all things that will give us a clinical picture of their metabolic health. So low triglycerides, consistently low triglycerides, may not always reflect a very good metabolic system. I hope this helps. And this is another pair of health wisdom. Please don't forget to like, follow, share, and most importantly, subscribe so that we can keep this conversation going. We'll see you in the next video. Thank you.